We're now going to go inside the Animal Care Center. It's a place that they film wildlife docs. It's right across from the elephant habitat. They do different things inside here. It's a good place when it's very hot to get some air conditioning. Things that they do inside, from nutrition to treatments, x-rays to surgeries. Take an inside look at the world-class care we provide to the over 2,000 animals that call Busch Gardens home. Let's go explore. Good. I have. Right.
Busch Gardens, but next door is the zoo hospital itself. So we're currently working on some wildlife cases.
All right.
A couple of wild birds that were found injured outside of Busch Gardens. They were rescued and then brought to us for treatment, rehab, and hopefully released back out into the wild.
All right.
So Dr. Pete is just going to see on one of our last cases right now. He's one of our veterinarians.
All right.
So feel free to say.
Thank you.
It's a bone that sort of supports their shoulders, so when they have that powerful downstroke of their wing, it doesn't collapse their chest cavity. So it sort of acts like an internal strut, if you will, on their body. And that bone was broken in the impact, most likely. So I guess she probably got hit by a car. That bone is broken near the base. That's why the two sides of her two shoulders there don't look equal on the x-rays, because that strut's broken on one side. Now the good news is that does heal up very well typically, and they do does allow for full flight when healed, but it's going to take a while. She's not going to be basically allowed to fly for about 6 or 7 weeks to let that fully heal in. So she's got a ways to go. And then probably her most severe injury is actually to her eyes. Bird eyes are structured a little bit differently than ours are as mammals. Birds actually have a row of bones inside their eyeball itself, and that allows them to have the great ability to focus. They can really stretch their lenses way more than we as mammals can. The sort of payback for having that great eyesight, though, is that their eyes are a lot less flexible than ours. If you and I, if we were to get poked in the eye, obviously it would hurt, but our eyes have some give to them. Bird eyes don't really have that give, so when they get an impact trauma, that pressure sort of goes through their eyeball and ends up causing damage in the back of their eye, and that's what she's had. She has damage to both eyes. One's a little worse than the other, and in fact on one side there's a little bit of blood present inside the eyeball, and that's actually blocking my view. I can't see the back of her eye fully in that side. So in terms of knowing how bad the damage is, I have to wait for the body to resorb that blood before I can fully assess that eyeball. So whether she's going to be releasable back to the wild yet is still actually up in the air. If that blood resorbs in that eye and things don't look like there's any permanent damage to the eye, she might be able to be fully released in the end. I think the pox is going to heal up just fine. I think that shoulder fracture is going to heal up just fine given time. But what I don't know for sure yet is how that eye is going to go. That one we'll still have to sort of wait and see. But she's got a good chance. We'll just have to sort of see how that heals up and assess it from there.
Do we have any questions for Dr. Pete? What are the scale-looking things on her feet?
Well, the sort of yellowish scale things that are actually the skin of her legs. With these guys, they don't have feathers all the way down. It is about part way down, and then their legs are kind of like really heavy, scaly skin down there. And the reason they have that down by their feet is when they catch their prey, sometimes it bites back, and they use their feet to catch the things they eat. So if she were to go down and grab a snake, for example, she wouldn't want the snake biting her, and if it does, she doesn't want to have a lot of damage from it. So their legs are tougher on the bottom end.
What was your question? The red gap pad?
How long does it normally take for the blood to go out?
How long does that normally take for the blood to be reabsorbed?
That can take about a month all told. We'll start to see some change within a couple weeks, so we might be able to get a better assessment in just 2 weeks, but for full resorption, it can take about a month.
Do you have any more questions for Dr. Pete?
What do you guys do for while she's healing?
Where's she going to stay while she's healing?
In this case, she'll actually stay with the wildlife rehabber while she's healing up, because she doesn't need surgery for either of those conditions. So she doesn't need to stay in the hospital with us. We'll send her back to the wildlife rehabber. But she doesn't need to stay in a small area where she doesn't try to fly. So they'll actually probably keep her in a large dog kennel, because that way she won't be tempted to fly at all with that injured shoulder. We don't want her to use that plane while it's healing.
Any more questions for Dr. Pete?
What is the worst injury you've ever seen?
What is the worst injury you have ever seen?
Oh boy, you know, we've seen a couple of pretty nasty injuries come through, especially on these wildlife patients, because these are usually, critically injured, either hit by a car or something like that. Some of the worst ones we've seen have been ones that were unfortunately illegally shot. There's no legal hunting season for raptors. You can't shoot them any time of year. And we've had a couple, especially unfortunately when Hunger Games was popular, we had several that got shot with arrows, and we had to take surgically remove arrows out of birds. So those are probably some of the worst trauma cases we've seen.
Any more questions for Dr. Pete today? That looks like it for questions. Do we have another patient coming up?
We do have one more patient, a little bit smaller. The next patient is going to be a wild screech owl that they found down on the ground, and they're not sure what's wrong with it. So we'll check it out and let you guys know what we find.
All right, thanks for the update.
You're very welcome.
These are wildlife cases. You know, just take care
So,
of
like Dr. Pete just said, we'll have another patient coming up pretty soon. They will be resetting the room first. Oh, looks like they're here right now, actually.
The rehabbers don't get
So, while our patient is getting ready to get set up, just want to give you a quick thank you for joining us. You're welcome to join us for this next procedure if you'd like. If not, enjoy your day at Busch Gardens.
lots of care of these animals. So that is a full-grown screech owl. Tell me about that. That's an adult screech owl. So, all right, guys.
Alright, cool. Well,
We're gonna keep
see a
moving.
lot of new faces with us.
We got a lot to do today.
We currently have a wild eastern screech owl with us. This is a bird that was not from our park. It was injured in the wild. A wildlife rehabilitator, especially licensed and trained volunteers that go out and help injured wildlife, has brought this animal into us. And our job today is to figure out what the extent of these injuries are. And I'm going to currently pass this off to Leilani, who will give you more information.
Alright, so this should be our last scheduled patient for the day, that little tiny screech owl. Let me fix our cameras for you. Believe it or not, he's just about fully grown at that size. Eastern screech owls are one of the smallest species of owls in Florida. They're kind of tied with the burrowing owl that you find a little bit farther south. But he is a wild bird. He is definitely not used to being in a hospital and being surrounded by people. So we don't want him to be stressed out while he's in here. So we are giving him some anesthesia, so he'll be asleep throughout this whole exam. And he won't be struggling and trying to get away from our vets. If he were doing that, he could worsen whatever injuries he does have accidentally. If he has a broken wing and he's flapping against our vet tech Kelsey, he could make that injury worse. So it'll be a lot easier for our vets to do the exam, and it'll be safer for the bird, and it'll be a lot easier to get x-rays. Try asking any animal to stay perfectly still while we get some x-rays. But that anesthesia is isoflurane. It's very fast acting and relatively safe compared to some other anesthetics. So it takes just a few minutes for them to fall asleep, as you see. In the room we do have Kelsey, the vet tech, in black scrubs. She's going to be monitoring the anesthesia and handling the bird throughout the exam. Dr. Maria in the blue polo is one of our 4 clinical vets who works here, so she's going to check all over the screech owl's body to see or feel underneath the feathers, looking for any kind of lumps or scrapes or injuries that aren't supposed to be there. She'll stretch out the wings to check for any tightness that could be in the joints or any instability in the bones that could indicate a break or dislocation. And since we'll look inside the mouth probably as well, but since it is an owl and they do rely on their vision for hunting, we're going to pay close attention to the eyes as well. Unfortunately, a lot of these little screech owls that are brought to us from outside the park will get hit by cars. They eat little tiny rodents and big insects that are attracted to the lights around roadways. A lot of people will throw food out the window figuring it's biodegradable and the animal will eat it. But unfortunately, that does attract small mammals like mice and rats to the road. And then birds of prey will swoop into the road and get in trouble that way. So we do want to make sure that there's no damage to the eyes. So Dr. Maria is going to do right now. We also have Rick in the back. He's one of our, he's our visiting vet student. He's doing a rotation through our hospital to get some experience with exotic vet medicine. Now, to help them see at night, screech owls have enormous eyes. If our eyes were the same size as screech owls, comparatively, our eyes would have to be the size of grapefruits in our eyes. They're also shaped a little bit differently so that they can see better at night. So instead of being spherical like ours, screech owl eyes are shaped more like doorknobs. So they do have bony structures around their eyes to support their eyeballs, and we have to make sure there are no fractures to those little tiny bones. Dr. Maria was just looking for any blood pooling, any tears in the retina, any sign that there could be some kind of vision loss. Our last patient did have some eye issues going on. Hopefully that's not the case with the screech owl. Alright. We do have another camera inside one of the surgical lights over the table. So sometimes we get a really good look at what our vets are seeing. So I put that up for you right now. Other times we get a good look at the floor or the backs of their heads. Our vets have control over that one. So Rick's feeling the wings and the joints right now. Now our goal is to get him back out into the wild. We're not sure what the screech owl's injuries are. Sometimes our rehabbers will come in with a guess or a clue as to what's going on. We did suspect that red tailed hawk we just saw had an eye injury, so our vets had that clue to go off of. But we're not sure with the screech owl. I think we just know he wasn't flying, so we're going to look for signs of a broken wing, but there could be some kind of trauma, some kind of impact trauma damage to his eyes, maybe some internal injuries. So our vets are going to do a full physical to try to get to the bottom of what's ailing this little screech owl. Is this anyone's first time at the Animal Care Center? Oh, quite a few of you, nice. Well, you visited us at the right time. Usually we do get started first thing in the morning, right at 10 o'clock. So that's the best time to stop in if you want to see a vet procedure, especially if you want to see something like a tiger or a gorilla or a venomous snake, which is always cool to watch. Usually that's going to finish up by about noon on most days. And then we switch gears and talk about other aspects of healthcare over in the kitchen, so good nutrition and enrichment for our animals. But we do see a lot of patients that don't live at Busch Gardens, a lot of wildlife.